We're joined by the President of Indian Medical Association, Dr. Asokan. Dr. Asokan, you've been in constant touch with the Health Ministry. What are your pressing demands after what has happened in Kolkata?
The pressing demand of IMA has been deterrent, a deterrent central law, which is eluding us. We had a draft in 2019, and we also, during the COVID times, an amendment in the Epidemic Diseases Act. Now they are all in their hands. One is a draft awaiting clearance, and another is a statute. It's there. So I don't think they should wait for giving us that after such a gruesome crime in a workplace. So far the issues had been violence after sudden death, which was qualitatively different from what has come today, is that the conscience of the nation has been aroused because a helpless lady doctor doing a 36 hours duty, going to rest for few hours, we didn't provide her safety. So there is something missing that we have to do for our daughters, leave alone the doctors. Daughters are more important because every parent is going to be concerned. So it is all the more important in workplace. We would want a deterrent law. The second thing is, law is one thing, but safety and security is another thing. We sincerely believe safety and security of a hospital is nothing inferior or nothing less than an airport. Airport has got a security protocol. Airport has got security personnel, and for the same valid reasons, the hospitals deserve security, a security protocol. So we also demand that a safe zone, a hospital as a safe zone, is a concept which we have put forward.
We have seen the violence, we have seen what kind of goons were involved in the violence, and this happening in a hospital is a sheer case of shame. I mean, it is shameful of such thing to be happening in a hospital. What do you have to say about that since you visited the site?
I can say about the hospital administration because, I do feel that there is some amount of indifference by the authorities in the hospital, and the boys and girls who were protesting. At the middle of the night, there were 300 people still sitting, and the type of vandalism that occurred is certainly a law and order issue. In the middle of the night, if such a thing can happen, it raises questions of breakdown. So these are two my observations. The administration also had failed, especially the principal, the colleagues. They also let her down. We had been to the parents. We talked to them. And they were very, very helpless, and they were saying that they were not allowed to see the body for more than 3.5 hours. And they had wanted to talk to the head of the institution. Head of the institution is in whom they had deposited their trust. But that trust was not reciprocated. Our two demands are at the policy level. And we met the Union Health Minister, Sri Naddaji. He was very sensitive to the situation. He asked so many data like, what percentage of women or lady doctors. We told him it's around 60%, and it's bound to increase. So, he feels the burden of responsibility. I'm sure something will come out. He will not let us down. We have that hope.